So why do we find that some men have beards while others don't? Actually, the facial hair growth is controlled by genetics. The hormones such as testosterone or DHT, at some point it is controlled by how sensitive your hair follicles are to these hormones responsible for facial hair growth. So you might find that you are low sensitive to these hormones that might hinder your beards from growing, or you have low testosterone hormones. At some point, some medications can also trigger facial hair growth. If you have some medical conditions such as thyroid disorders, can also affect your facial hair growth. Your lifestyle can also trigger this. At some point, habits such as smoking can also have an impact on your hair growth. While some men tend to lack the beards, some women have them. And the reason behind women growing beards is due to increased levels of androgen hormones. And when hair follicles become sensitive to these hormones, automatically the beards will start to grow. In most cases, women with polycystic ovarian syndrome have high chances of growing beards. Why? When you have this condition, the androgen hormones increases. In such scenarios, you will start to grow the beards. And when women reaches menopause, estrogen levels reduces, androgen hormones increases. In that case, you might start to grow the beards. Some medications can also trigger this. Some medical conditions, ovarian tumors, can also contribute to women growing beards. Men lacking beards and women having beards at the same time can be corrected depending on the underlying cause. If the cause is genetics, unfortunately there is no medication that can permanently change your genes, so it might be quite difficult to correct that. But if the cause is hormonal, this can be worked on. If maybe a woman is having polycystic ovarian syndrome, we can at least treat the underlying cause to reduce the levels of androgen hormones.